Social justice charity Nacro is calling for prison workers to be considered as a priority for the COVID-19 vaccination. They're not included in the guidance from Joint Committee on Vaccination and Immunisation, despite reports that staff absence due to illness or the need to self-isolate is significantly straining already stretched resources. Miriam Khan is a Nacro Resettlement Advisor who works in a prison but hasn't been able to work face-to-face since March last year. Morning, Miriam.
Morning.
Tell us about your role and how you were working before the pandemic.
So as a resettlement advisor, we are very much a face-to-face based kind of profession. We see all prisoners when they come into prison and also in their resettlement. So pre-COVID, we were seeing up to maybe 30 prisoners in an afternoon, and COVID has taken sort of that face-to-face interaction away from prisoners, which sort of doesn't prevent us from supporting their resettlement, but it sure brings a lot of barriers.
Is it possible to do that sort of stuff remotely?
No. I mean, I'm lucky that the prison that I work in has access to in-cell phones, but I am fully aware that not all prisons across the country have that sort of access. So we can't just work from home. It's very difficult to do our job sort of remotely and working from home.
So, and when do you think you could get back into it? It could be ages, couldn't it?
Yeah, I mean, the way it's looking, it potentially, yes. I know luckily this vaccine's come out and that brings a little bit of hope, but we're still far away from getting back into face-to-face just because of how long it might take for individuals to get vaccinated and when guidelines permit us to go back to being face-to-face.
Do you think that prisons, for understandable reasons in some respects, I suppose, aren't considered when people can look at the whole response to the virus? Do you think that's hard for people who work there because they have difficult jobs to do? They're also working in a place which you could imagine COVID could run through very quickly. Is it a concern for people who work in prisons who have to go in there because it could be dangerous?
I mean, massively. I mean, when we go to the supermarket, we're governed by sort of the 2 meter distance. In prisons, it's impossible to try and maintain 2 meter distance from prisoners. You know, if a prison officer has to deal with an act of violence or an act of self-harm, how do you obtain that 2 meter distance? So prisons, as much as you can implement all these guidelines, it is very difficult for prison officers to be able to maintain social distancing, which in turn they are jeopardising their health and even more so their family's health.
How do they feel? Because we hear on this radio station, we had Kit Malthouse on, who's the policing minister, and he said, police should get a priority vaccine. You do hear lots of people kind of nod, agree with that when people say that. How do wardens feel that they're not considered part of the justice system in quite the same way?
I mean, last year on social media, there was a trend saying our forgotten heroes, and I think prison officers are very much our forgotten heroes. I think when we are thanking the NHS, and with all due respect, I think hats off to the NHS. When we are thanking our supermarket workers, I feel like we forget our prison officers. I feel like we forget that they also wear a uniform day in, day out. They deal with some of the most chaotic, high-risk, violent offenders that society has. So I do feel like they are pretty much forgotten about during sort of discussions when it comes to COVID, during being a priority group when it comes to COVID. And I do think prison officers up and down the country echo that they do feel that they're not very much included in such conversations.
Yeah, and if that continues, the vaccination rollout goes on for the next 3 or 4 months, and then you start seeing a prioritisation of certain workers. You can imagine teachers being very much in early receipt of the vaccine, particularly if it looks like it's stopping transmission, because one of the reasons that stops schools opening is the fear of transmission. You can imagine teachers getting vaccinated. You can imagine shop workers, actually, with the national mood, correctly so, about how we've been supported. If there is no special treatment for wardens and therefore it takes months and months and months, what does that mean, in your view, for how the prison system will function over that period?
You simply cannot just shut down a prison system. Staff will still need to go to work and endanger their own health. And let's not forget, some of the prisoners themselves are quite vulnerable as well. And in prison, people often share cells, they share facilities. So I do generally think that, you know, if COVID did impact the prison system, it could be quite a hard situation.